Bismillahirrahmanirrahim. Quote of the day: the only secret behind a good day is a good attitude. Assalamu alaikum. Today, the topic of my presentation is smallpox. It is one of disease which is completely eradicated from the world, and the WHO announced in 1980 about the eradication of this disease. The kind supervision of Professor Dr. Saira Afzal. Learning outline of my presentation is epidemiological triad, mode of transmission, level of prevention, efforts toward eradication, updates, and MCQs. In the end of this presentation, participants will be able to describe about smallpox infection and efforts towards eradication. Introduction and the burden of disease. In the early 1970s, it was an epidemic in 31 countries. Every year, 10 to 15 million people contracted the disease and approximately 2 million died. People struggled to find ways to battle with smallpox. It was also potentially one of the most devastating biological weapons. It was an acute contagious disease. The disease was also known by the Latin names variola and variola vera. The pox part of smallpox is derived from the Latin word spotted and refers to the raised bumps. The term smallpox was first used in Europe in the 15th century to distinguish variola from the great pox, which is also known as syphilis. Now it's come epidemiological triad. There are three factors which involve in epidemiological triad: agent factor, host factor, and environment factor. In agent factor, there are two variants of smallpox virus, variola major and variola minor. Variola major form is severe and most common form, result in confluent smallpox, and the death rate is very much high, about 30%. In variola minor is less severe and less common, result in discrete smallpox, and the death rate is almost 1%. In host factor, all ages and gender affected equally, and once the disease is developed, it gives lifelong immunity to the person who acquire a smallpox, who suffered from the smallpox. In environment factor, poor sanitation condition involved and the overcrowding is responsible for the spread of this disease. There are many types of variola major form: ordinary type, modified, malignant or flat, or hemorrhagic. Ordinary is a most common form and 90% of cases in unvaccinated person, and case fatality rate is almost 30%. Modified is a milder form, produce fewer, smaller, and more superficial lesion. 2% of cases in unvaccinated and 25% of cases in vaccinated person. Cases of modified smallpox were rarely fatal. Malignant or a flat type, lesions were flatter, evolve more slowly and quiescent. 7% of cases in unvaccinated person, and the case fatality rate of the malignant form is almost 97%. Hemorrhagic form is difficult to diagnose, rash accompanied by bleeding into mucous membrane and skin, less than 3% of cases, and case fatality rate is near 100%. Chain of transmission. The virus is transmitted through a respiratory route or inoculation of a skin, and the excretion from mouth and nose is responsible for the source of infection, and some other infectious material like saliva, scabs, urine, and blood. This disease is transmitted from one person to another person by coughing, sneezing, breathing, person-to-person contact with contaminated clothing or beddings, or infected bodily fluids. There are different sign and symptoms. This disease is present by various sign and symptom, and different phases of the rashes is involved in the sign and symptom. The first phase is prodrome phase, in which person is complaining about fever, head and body aches, vomiting. People are sick and last almost 2 to 4 days. Then the second stage is the development of early rash. This stage lasts up to 4 days. It is most contagious state. Rash emerge as a small red spot on tongue and mouth. Rash will appear on the skin of face, then arms and legs, finally on the hands and feet. Rash spread through the whole body in 24 hours. On third day, rashes change into bumps and then it fills with a thick fluid. Third stage is a pustular rash. It is lost about almost 5 days. Individual is still contagious. Bumps now become pustules. And in the fourth stage, there is the formation of crust, which is last about 5 days. Individual is still contagious. Pustules form crust and then scab. And the final stage is our scabbing. It is last about 6 days. Individuals are still contagious until last smallpox falls off. Most scab will fall off after 3 weeks from the appearance of rash. There are complications when disease is not treated properly. Then there is the complication like heart failure, myocarditis, pneumonia, encephalitis, viral osteomyelitis, corneal ulcer, and loss of vision. Then comes the level of prevention. There are many levels of prevention like primordial, primary, secondary, and tertiary level of prevention. In the primary level of prevention, there is a health promotion and a specific protection. And in a health promotion, we educate the people, isolation of a positive case, wearing mask, and a habit of cleanliness. And in the specific protection, there is a variolation and a vaccination. Now, what is variolation? Variolation is the process by which material from a smallpox source was given to a people who had never had smallpox. This was done either by scratching the material into the arm or inhaling it through the nose. With both types of variolation, people usually went on to develop the symptoms associated with smallpox, such as fever and rash. The basis for vaccination began in 1796 when an English doctor named Edward Jenner observed that milkmaids who had gotten cowpox did not show any symptom of smallpox after variolation. The first experiment to test this theory involved milkmaid Sarah Niles and James Phibbs. And the second is the specific protection is vaccination. And the vaccination is the live vaccine virus administered using bifurcate needle, not an injection, dipped into vaccine and then prick the skin 15 times in about 3 seconds in 5 millimeter radius, administered into superficial layer of skin and given on right side universally. This is the normal response of a smallpox vaccination. First dose and then a booster dose. Vaccination became widely accepted and gradually replaced the practice of variolation. In the 80s, the precise time remains unclear. The virus used to make the smallpox vaccine changed from cowpox to vaccinia virus, which is a live vaccine. And then there is a secondary prevention in which the early detection and the prompt treatment is involved. In early detection, we perform different tests like traditional confirmatory method involve electron microscopy of vesicle fluid, culture on chick membrane or a cell culture. and a new rapid test is available only at reference lab, PCR, and the CDC proposed evaluation criteria for clinicians to rule out patient with a rash, major criteria and a minor criteria. Febrile prodrome phase, classic lean appearance, and in a minor criteria, centrifugal distribution and a slow rash evolution and toxic appearance. When is the prompt treatment? There is no as such specific treatment of the smallpox. Only supportive medical care is given. Isolate a person until all scabs have fallen off. What are the efforts towards eradication which are performed by our WHO? In 1959, the WHO initiated a plan to get rid the world of smallpox. The intensified eradication program began in 1967. Laboratories produce more higher quality freeze-dried vaccine, production of bifurcate needle, start surveillance system, and a mass vaccination campaign. What are the factors that allow eradication? The disease has a slow spread, effective and relatively safe vaccine, no animal reservoir or a vector, no significant carrier state, infectious only with symptoms, infection gives lifelong immunity, and the international cooperation. It's time for updates. 1980, the World Health Organization launched an intensified plan to eradicate smallpox. Widespread immunization and surveillance were conducted around the world for several years. The last known natural case was in Somalia in 1977. In 1980, WHO declared smallpox eradicated, the only infectious disease to achieve this distinction. This remains among the most notable and profound public health success in history. Research purpose. Variola virus causes disease only in people. Other pox-like virus such as monkeypox can infect both animals and people. This unique characteristic of variola virus makes it an important virus to study and help us learn about infectious disease. Research using variola virus continue to expand our understanding of how viruses infect cell and how the immune system respond to infection. The goal of smallpox research is to address three areas that are essential for public health: finding better antiviral drugs to treat smallpox disease, making safer vaccine, improving tests to detect variola virus. There are two WHO designated sites where stock of variola virus are stored and used for research. CDC in the United States and the Russian State Center for Research on Virology and Biotechnology. Why the smallpox virus is very much found in the bioweapon potential. There is a many prior attempt used as a bioweapon in the French and Indian War. British gave Native Americans infected blankets, allegation of use in US Civil War, and alleged use by Japanese in China World War II. Can be produced in large quantity. It is stable for storage and transportation, produce stable aerosol, high mortality, and person-to-person spread. Most of the world has little or no immunity, so the smallpox virus is used as a bioweapon potential. Now it's time for the MCQs. Smallpox was a viral disease and it spread through close contact with infected material. When smallpox is most infectious, once sore develop in mouth, once sore develop in throat, once rash develop, increase in temperature of body.
D.
C is the right answer once rash develops. Smallpox is completely eradicated and there are no cases of smallpox anywhere in the world. Which number of cases should be considered for outbreak? 1 case, 10 cases, 100 cases, or 1000 cases?
A.
A.
A is the right answer. 1 case. Smallpox was very contagious disease, which symptoms initially report by the patient in OPD settings: rash, fever, headache and body aches, vomiting.
A.
B, fever is the right answer. There are multiple stages of sign and symptom of smallpox. Which trace of smallpox often remains after the infection? And chronic fatigue, poke marks on the face, blindness, sensitivity to sun.
B.
B, poke marks on the face is right answer. Initially, vaccination was done for treating the patient of smallpox, and then vaccination was started for treating the patient. Which type of needle is used for vaccinate the patient? By 5 cc injection, by a single needle, by a 2-prong needle, and 10 cc injection.
C.
C is the right answer, 2-prong needle. Eradication of smallpox was a big challenge for WHO at that time. Target has been achieved due to following epidemiological facts: high effective vaccine, no long-term carriers, easy case detection due to rash, elimination of animal reservoir.
A.
D, elimination of animal reservoir. Formation of smallpox vaccine was very much important at that time because million of cases report and case fatality rate was also high. What was the name of English physician who discovered this vaccine? Sir Marius Hillman, Sir Edward Jenner, Sir Camille Gorion, and Sir Behring.
B.
B.
B, Sir Edward Jenner is right answer. Working on the synthesis of vaccine started after 1780. The vaccine used to eradicate smallpox originated as live smallpox, live cowpox, genetic recombinant killed whole virus.
B.
B, live cowpox is right answer. There are various types of variola major. Which type of variola major have case fatality rate more than 95%? Ordinary type, modified type, malignant type, hemorrhagic type.
C.
C, malignant type is right answer. Global eradication of smallpox was a great achievement of WHO. When WHO announced the global eradication of smallpox, April 1977, 1979, May 1980, May 1980.
C.
C.
C, May 1980 is the right answer. This is the key of my MCQs and thank you.
Okay, thank you very much, Dr. Naila. Very nice presentation. However, I always emphasize that more MCQs should be on concepts rather than on rote learning. And overall, it is a good presentation. Thank you very much. Allah Hafiz.